A lot of issues being discussed are probably best addressed by effective harm reduction campaigns. Do the speakers support harm reduction campaigns? I mean, that's a generic question for panel. Anyone specifically want to address that?
I might begin, if that's all right, Shane.
Yeah, certainly, Professor John, go.
Yeah. Okay. I mean, yes. I mean, in Australia, we've got a sort of proud record of harm minimisation, harm reduction campaigns. But I guess that one of the main messages here is that prevention is obviously should always be the first step that you take. And if we're seeing increased rates of use and we're seeing that this use is associated with increased harm, then it does seem that there's a fundamental problem with legalisation. It's actually creating risk factors that are going to make the harms more widespread. So I guess that from my presentation of what I'm seeing in the data that I presented from the International Youth Development Studies, it does seem to me that there is no evidence that I can see that the forms of legalisation that are being studied so far in the various state and national experiments are doing anything other than increasing the amounts of use. And it would seem very obvious that you're going to have quite extensive harms. That being the case, I think that it becomes difficult to imagine the scale of the effort that you're going to need to remedy that level of harm. So I think that would be a very costly exercise, and it just seems to me that, again, I just repeat that mostly we know that prevention is a much more efficient way forward, and prevention in this case actually would suggest that you've got to sort of stop the widespread public health issues that come where you have increased use that's harmful. So that's where I'm sitting at the moment on the issue.
Sure.
And if I could just add another little bit to that. So what we've seen here in Colorado is that what happened when we legalized is that there was normalization of use. So we actually have been limited by a lot of people with regards to harm reduction. So kids are seeing it be normalized use with their parents, their adults in their lives, and they're following suit. So harm reduction would have to be doubly intensified because we've normalized this. It is far cheaper to prevent than it is to treat a problem. And additionally, what we found is that, or what we're seeing here in my community, is that even though we have tried harm reduction, use is going up, harms are going up. And despite that, we've had to close our treatment programs because we don't have enough funding. So I'm not a fan of harm reduction. I don't think that you can liberalize and encourage the use of drugs, which you would have to do to make taxes, and then call harm reduction.
Anybody else want to chime in on that one before we go to our next question?
I'd just like to comment and agree in terms that with policy changes like legalization, there's no amount of harm reduction interventions that can address the great increase in risks of initiation and increased use, as my colleagues here have mentioned. But nonetheless, I think, in Australia, we had some level of harm reduction, which when legalization of medicinal came in, was completely abandoned rather than accelerated. It seems that governments can only do one thing at a time. And I think a more sophisticated approach of including in the spectrum of harm reduction, very strong emphasis on prevention and delay of initiation. But for those who are going to use, and I think prohibition may be desirable, but it's not very realistic, we should also have targeted intervention programs to prevent accelerated use of dependence, safer ways of use, such as not using more than once a week, etc. Some kind of evidence-based messaging to the community and to users in a way that they're going to find palatable and useful, I think should be included in our overall approach to reducing cannabis-related harm.
Okay, thank you.
I would like to make a statement additionally, we need to be very clear that this is not just simply a campaign to legalize or decriminalize. What we've seen in the US and in Canada is a massive commercialization. So this is about driving profit, and it's 100% about driving. So when you legalize any product for profit, then the goal is commercialization so that you increase use, get more profit. So when you talk about harm reduction, that's completely antithetical to what is happening with cannabis. So if you want a true, decriminalization or a true legalization that reduces harm and discourages increased use and that type of thing, then it would be the opposite of the commercialization that we're seeing, and would come with severe limits on THC potencies. It would come with limits on marketing and broad commercialization. Here in the U.S., you're not supposed to be able to market an illicit drug, and yet there's billboards and newspaper articles and magazines, and it's all over the internet. And so you really are, what we're creating is a false paradigm. We're trying to put this really nice spin on it, like we're just going to legalize and decriminalize, but that's not really what's happening. So the realistic conversation is, how do you prevent mass commercialization for those who are posturing to make big money? Make sure the conversation is honest and legitimate, and then you'll have a better discussion.
Thanks, Charlie.
I agree. And fortunately here in Australia, commercialisation of cannabis, whilst the proponents of it have been pushing a lot of these policy changes in the hope of changing our culture, but I agree what's happened in the US with commercialisation and in Canada and other places, it's, incompatible with prevention and harm reduction. But there's some hope in Australia because we've seen decriminalisation work without commercialisation. And I think we should sell that message, that we have a workable model in many of our states. And a lot of this discussion here is just not, it's un-Australian. What can I say? Commercialisation of drugs is not on.
Sure. Okay, thank you, panel, for that. Brilliant. Second question, sort of similar, and interestingly, it's a bit of a loaded one. The failures in rolling out appropriate public health measures in legalisation can be learned from. Well, I think our opening excerpt from that town hall demonstrated that this has been in play for 8 years and nothing's been learned. In fact, everything's accelerated. But the question says, I suppose my question, how does prohibition better address these issues than open public health campaigns funded by a legal industry? So I'll open that up. Again, public health. Anyone want to buy into that one?
I think I will just chime in first and then let the probably better experts comment on after. I really believe that prohibition is a hotbed word. It's rhetoric, because discouraging drug use and coming at any type of drug use from a preventive point of view has become associated with the dirty word of prohibition, and then pointing back to the prohibition in the earlier part of the last century as, look how much harm this caused. But we know that prevention works. Prevention that has been implemented for decades has had wonderful successes. So again, I think it's another one of those red herring conversations to try to throw people off and take the conversation down a different path rather than solving this issue and finding a better model or having a better conversation.
Thank you, Joe. Anybody else?
Look, I'll add to that by saying that I do think that at the moment what we're studying is what we have available. So we're really studying the experiments that have occurred at the moment in looking at the way that legalisation and decriminalisation are working in practice. And so I think that the first thing to say is that however you might envisage a model that might have sufficient learning in it, that it could actually learn from what's happened to date, I think what we have to admit at the moment, and that I think that what we're seeing in the presentations we're hearing today is that the way that legalisation is occurring at the moment is not fulfilling many of the promises that proponents of legalisation have put to us, that we would be able to contain problems such as the increased acceptability, the perceived prevalence, the reduction in price, the increase of potency. All of these things, I think, when we were initially looking at arguments that proponents were putting to us, that they were suggesting that these wouldn't occur, that they could be contained in some way. So the first thing to say is legalisation has not contained these things. We're seeing increased use, we're seeing increased harms. So I think that to put the idea that there may be some other model that's available to us by which we could contain these harms, I think I'd like to see what that might be. But at the moment, I think that today's presentations sound a loud warning that we had a vote recently, just narrowly missed in New Zealand, that the populace there decided not to go down the road of legalising recreational use. Now, New Zealand's a very sensible country and it's a bit more like Australia, and I guess that there might have been efforts there to try to reduce the problems we're seeing with legalisation that have occurred to date. So how are we going to, with these new models, contain the price drops that occur and the increases in potency that we're seeing? I'm not seeing anything on the table that suggests to me that can be contained. How do you contain the problem of increased perception that it's socially acceptable and that it's prevalent in different groups that drives your tendency to again, these are the basis of changed social norms. So there's just nothing in my mind I can see by way that you would be able to. I don't see any proposal to reduce those things that drive increased use. And at the moment, we're not seeing any evidence that this use is made safe by somehow the changes in legalisation.
Brilliant. Thank you, John. Any more questions coming to the fore, Paul? No, there's not at this stage. Before we sign off and finalise today, we've gone a little bit over. I do apologise again. Technical difficulties has created some of that issue. I want to say thank you again to all our presenters. And I think the public health issue remains the single greatest driver of policy management in this space. And I think that what we're seeing and what we've heard today, just in short, and these presentations are only a snapshot, ladies and gentlemen, of bigger resources and larger studies and evidence. And I encourage you to, again, engage with our presenters and their specific websites, their studies. These people aren't out to bang a particular drum. They're not prohibitionists, they're not abstentionists. They are people concerned with public health and good evidence-based science, which the industry, the cannabis industry, has little interest in because it's about profits and drivers. There is a statement that has been said to me many, many times, and I don't disagree with it. That is, you cannot arrest your way out of the drug problem. Concur, I concur. But you certainly will not treat your way out of this problem either. In fact, you'll create an even bigger hole. And the concerns that we have is that the current laws are not being tasked effectively to actually bring about what should be happening, is a leading away from drug use, not a punitive response, not a incarceration, not a legislative response that creates criminal records and all things. But more importantly, it enables people to delay uptake, deny uptake, and more importantly, to be the citizens they can be with drug-free. So there's another question just popping up now before we go. What is it? Ask a question for Karen, directed at Karen. Still coming. It's interesting. The drug that does the single drug that does the greatest harm in our community is still the legal one of alcohol. And the concern we always have is, why would you add another drug to that regimen? Because legality.
I think the question. Sorry, I think the question is. Is there evidence of progression of cannabis use to other drugs? Look, if I can just chime in initially on that to say, in my presentation, what I was showing is that where we did the longitudinal follow-up, we were seeing that cannabis use, in adult cannabis use in the legal context, was actually predicting firstly, the first thing we see is increased persistence and further uptake of cannabis later on as being more common in the legal environment. But we do see that it's a predictor of maintaining or increasing tobacco use, but also use of opioids. So those things are coming through in the data that I was analysing in our cross-national longitudinal study.
Certainly, Karen, you want to chime in on that one?
And I mean, we've been accused numerous times of being prohibitionists per se. And I think what we're all trying to say is that there are public harms that we can see and that are occurring, but not only occurring, but occurring with momentum. So we know that our youth are using more than recent Healthy Kids studies show that youth are using more than 20 to 30% more than they were 2 years ago. And so we can see that there are more public health harms, there are more harms in the workplace. And before you legalize, you have to understand, you can't just prohibit because it's already there. So you could decriminalize what you have, but to legalize is what Joe said, you're commercializing. And the problem here that we have is not only was it commercialized, we're talking about this incredible potency that is so harmful for the public. And it's not, looking at it from a health perspective, it's not beneficial. We're seeing hyperemesis. We see that daily in our emergency department, and there's a huge cost to care for these people. And that cost of care is being funneled back to the individual taxpayer, and it'll happen to you guys too. And it's the psychosis, and the psychosis is exceptionally frightening and exceptionally concerning because it can happen anytime. There are early studies out that show not only can you have psychosis in the user, but there may be a related link, and I can give the information to Shane, that there may be a related link to having emotional behavioral problems in off-of users, and we're seeing that as well. And so all these costs are being generalized back. So it's not that we want to prohibit everything, it's that we have to bring up, I feel it's my duty as a physician that I see and I treat these people every day. It's my duty to tell you, here's the harms. I'm not a policymaker. Before this all happened, the federal government set forth a Cole memorandum. I suggest you look it up. It has outlined the principles that they said, if these things happen, the federal government will shut it down. One of the 8 points was that youth using more. Well, we know our youth are using more. Not only they're using more, they're using high potency. Didn't shut it down. That it won't be, that the federal government or federal land won't be used. We know that there are hundreds, if not thousands, of illegal grows right here in Colorado on federal lands. And we know that the illegal market has blossomed. So when we look at the principles set forth, we're not even enforcing what we have, and the same will happen to you. So it isn't prohibition. You have to take a realistic look at what happens to your people and what happens to your population when you liberalize the amount of drugs being used, and not only liberalize, but you have industrialized the strength. And that, I guarantee you, is when they start in high school or junior high school, they will look for a bigger and better high. And if you look at my study, where we're looking at urine drug screens that are done in the community, you can see that most drugs are going up. So the usage of not just cannabis, but other drugs in the environment are going up. And we're seeing kids in high school. We're seeing kids in junior high school using these drugs now. And so it isn't prohibition that we're saying, no, it is the fact that the harms are monument. And there's no way to overcome these harms. You will have an illegal market, you will have youth usage, and you will have increased medical harms.
Brilliant. Team, you've been fantastic. Thank you so much. Delegates, thank you for your patience with us today. Thank you for sticking with us. Thank you for the questions that have been asked. Again, I encourage you all to visit our website, and all these presentations will be online, but more importantly, the details of all presenters will be there, so you can contact them and continue your investigations, get the evidence that you need to make informed decisions, particularly for public health and the well-being of our families and communities. On that note, we will close this webinar and Q&A, and thank you again for being part of this important event.
Thank you, Shane.
Thank you.
Thank you, Jen.
Thank you.